Ebola virus has taken a significant toll on healthcare workers. More than 200 have died in West Africa, and many more have been exposed. That makes the protective suits that medical professionals wear critical to their safety. CCTV's Hendrik Sybrandy reports how a suit is put on and taken off can be extremely important.
These are some of the tools of the trade for doctors and nurses fighting the Ebola epidemic, what's known as personal protective equipment.
It's absolutely instrumental to prevent further infection.
At Project Cure in Centennial, Colorado, a major provider of donated medical supplies to developing countries. Shall we plunge in here? We got a first-hand look at what healthcare workers on the front lines of this fight are wearing to keep themselves safe.
Yeah, I mean, it's a long process.
Operations specialist Oliver Cunningham is talking about all the steps involved in putting on a protective anti-contamination suit. An assortment of different items cover the feet, the hands, and the rest of a person's body.
Any reduction of the risk through covering your skin and through, protecting all potential areas, that's the way to best reduce the likelihood of transmission.
The goal is to keep a patient's bodily fluids from touching the skin of the person treating that patient or even the clothing covering the skin.
If they get any fluids on their clothing that maybe would then subsequently contaminate them, then that could be a source of infection. We really don't know.
Once the last duct tape has been applied, the suit wearer is sealed off from the environment, at least as much as possible.
This gets pretty hot in Africa, doesn't it?
Like you can see right now, the goggles are fogging up. We actually have anti-fog spray.
It's also hard to talk.
Absolutely.
And to be understood by whoever you're treating.
The process of removing the suit may be even more important and even trickier. Taking off the gloves takes some practice.
Now you take this and then you roll off the other glove. Both contaminants are inside. You're not touching anything contaminated.
The key is attention to detail and carrying out all these steps correctly. At a time when even those wearing suits have been infected, a health worker's life depends on it.
It's really important that the process is taken extremely seriously.
Hendrik Sybrandy, CCTV, Centennial, Colorado.